Hello and welcome to my channel. What if everything you knew about this was wrong? Today we are uncovering the truth and trust me, you don't want to miss it.
The letter arrived in a plain government envelope stamped with the seal of the United States Public Health Service. It promised free medical care, free meals, even burial insurance for hundreds of poor black men in rural Alabama during the Great Depression. That letter must have felt like a miracle. It wasn't. For 40 years, those men were told they were being treated for bad blood. In reality, they were part of one of the most disturbing government experiments in American history, an experiment officials quietly allowed to continue long after a cure was discovered. This is the story of the Tuskegee Syphilis Study, a real documented program that sounds like a conspiracy theory, yet is confirmed by government records, congressional hearings, and presidential apologies. In 1932, Macon County, Alabama was one of the poorest regions in America. Most families were sharecroppers. Medical care was rare, expensive, and often inaccessible. When federal health officials partnered with the Tuskegee Institute, the program was presented as a humanitarian effort to treat syphilis in black men. 600 men were enrolled. About 399 already had syphilis. The others did not and served as a comparison group. None of them were told the real purpose of the study. None gave informed consent as we understand it today. Most were illiterate. Many trusted the doctors completely. At first, the plan was to observe how syphilis progressed in black men who were not treated. Some white physicians at the time falsely believed the disease affected black patients differently than white patients. The study was supposed to last a few months. It lasted 40 years. Here's where the story turns from questionable science to something far darker. In the 1940s, penicillin became widely available. By 1947, it was the standard, effective cure for syphilis. Public health campaigns across America worked aggressively to treat infected citizens. Except in Macon County, the men in the Tuskegee study were deliberately denied penicillin. Doctors intervened to prevent some participants from accessing treatment elsewhere. Draft boards were contacted during World War II to ensure the men were not treated by military doctors. They were told they were receiving special free treatment. In reality, many were only given placebos, aspirin, or diagnostic spinal taps, sometimes described to them as special procedures. Over the years, the disease ravaged their bodies. Syphilis can cause blindness, paralysis, mental deterioration, organ failure, and eventually death. Some of the men went insane, some died, wives were infected, children were born with congenital syphilis, all while federal officials continued to collect data. If this sounds like something that would be exposed quickly, consider the climate of the time. This was the era of segregated hospitals and deeply entrenched racism in American medicine. The men involved were poor, rural, and politically powerless. Their suffering was invisible to most of the country, but secrets rarely stay buried forever. In 1966, a young public health worker named Peter Buxton learned about the study and was horrified. He filed internal complaints. They were dismissed. He persisted. Finally, in 1972, he leaked the story to the press. When the Associated Press broke the story in July 1972, it detonated like a bomb. Headlines across the country revealed that the federal government had knowingly allowed hundreds of black men to suffer and die without treatment even after a cure existed. Public outrage was immediate. Congressional hearings followed. The study was finally shut down that same year, but the consequences could not be undone. By then, at least 28 men had died directly from syphilis and more than 100 from related complications. Dozens of wives had been infected. At least 19 children were born with congenital syphilis. The true numbers may never be fully known. In 1973, a class action lawsuit was filed. The government settled for $10 million and promised lifetime medical benefits and burial services to surviving participants and their families. Yet the damage went far beyond financial compensation. The Tuskegee study shattered trust between black communities and the American medical system. That mistrust echoes into modern debates about vaccines, clinical trials, and healthcare access. When some people say the government experiments on its own citizens, they are not speaking in metaphor, they are remembering history. In 1997, 25 years after the study ended, President Bill Clinton formally apologized on behalf of the United States government. In a White House ceremony attended by surviving participants, he acknowledged the injustice, calling it deeply, profoundly, morally wrong. But even that apology contained a twist of irony. The study had been authorized by respected institutions. It involved doctors with advanced degrees. It was funded with federal dollars. It was not a rogue operation hidden in a basement lab. It was bureaucracy, routine, documented, filed away in reports. That is perhaps the most unsettling part of this story. There was no secret underground facility, no shadowy mastermind in a dark room, just official letterhead, medical charts, and decades of indifference, and Tuskegee was not an isolated moment in American history. During the Cold War, other ethically questionable experiments came to light: radiation exposure studies, secret drug tests under programs like Project McUltra, and biological weapons research conducted under layers of classification. While not all of these programs were identical in scope or cruelty, they shared a common thread: secrecy justified by national interest. The difference with Tuskegee is that it targeted a specific vulnerable population under the guise of medical care. It weaponized trust. Imagine being one of those men. You go to the clinic, you shake the doctor's hand, you believe you are receiving help, you bring your friends, encouraging them to sign up because it seems like a blessing in hard times. Year after year, you return unaware that your worsening condition is being observed, documented, and deliberately left untreated. It reads like fiction, it feels like conspiracy, yet it is supported by congressional transcripts, medical records, and sworn testimony. In response to the scandal, sweeping reforms were introduced, institutional review boards became mandatory. For federally funded research, informed consent standards were strengthened. The National Research Act was passed, establishing new ethical guidelines for human experimentation. Modern research ethics in the United States were in many ways forged in the shadow of Tuskegee. So was this America's secret experiment the government tried to hide. For 4 decades, yes, it operated quietly, protected by bureaucracy and indifference. It took a whistleblower and a journalist to bring it into the light. And when it was exposed, the truth was so shocking that many initially struggled to believe it. The story forces uncomfortable questions. How many people knew and stayed silent? How does prejudice shape science? And what safeguards truly prevent such abuses from happening again? History is rarely clean. It is complicated, flawed, and often painful. But it is only by confronting these chapters honestly that trust can be rebuilt. The men of Tuskegee were not lab rats. They were fathers, husbands, farmers, veterans. They laughed, worked, and hoped like anyone else. Their lives were reduced 2 data points in a study that should never have lasted beyond its first year. Today, the legacy of the Tuskegee Syphilis Study stands as both a warning and a catalyst for reform. It reminds us that skepticism can be healthy, that transparency matters, and that ethical lines in science must never be blurred for convenience or ideology. Conspiracies thrive in the shadows, but sometimes the most chilling stories are not theories at all. They are documented history, stamped with official seals, signed by trusted authorities, and hidden in plain sight until someone dares to read the fine print, and that is what makes this story unforgettable.